Understanding pneumonia, symptoms, treatment, and prevention. Welcome to Rerzeh Health, your guide to better health and wellness. Introduction. Pneumonia is a serious infection that inflames the lung tissue, usually caused by bacteria, viruses, or fungi. The tiny air sacs in the lungs fill with fluid or pus, making breathing difficult. While pneumonia can affect anyone, it is more common during autumn and winter, and certain groups are at higher risk. A historical perspective on pneumonia. Pneumonia has been recognized for centuries as a deadly disease. Before the advent of antibiotics in the 20th century, pneumonia was a leading cause of death worldwide. In 1918, during the Spanish flu pandemic, many fatalities were due to pneumonia as a secondary infection. The introduction of antibiotics drastically reduced pneumonia-related mortality. Today, vaccines and improved healthcare systems continue to fight this disease, yet it remains a significant global health concern. Symptoms of pneumonia. Symptoms may appear suddenly within 24 to 48 hours or develop gradually over several days. Common symptoms include 1. Persistent cough, often producing mucus, may be yellow, green, or bloody. 2. High fever and chills. 3. Difficulty breathing or shortness of breath. 4. Chest pain that worsens when breathing or coughing. 5. Fatigue, weakness, and loss of appetite. 6. Confusion, particularly in older adults. 7. Sweating and shivering episodes. 8. Nausea and vomiting, particularly in children. Differences between pneumonia and other respiratory illnesses. Pneumonia can be mistaken for other respiratory illnesses, such as bronchitis, tuberculosis, or COVID-19. Unlike bronchitis, which mainly affects the bronchi, pneumonia infiltrates the lung tissue itself. Additionally, while the flu and COVID-19 can cause respiratory symptoms, pneumonia often results in fluid-filled lungs, which can be detected via X-ray. When to seek medical help. Seek immediate medical attention if you experience 1. Severe breathing difficulty, e.g., gasping, choking, or struggling to speak. 2. Intense chest pain or pressure. 3. Pain spreading to the arms, back, neck, or jaw. 4. Extreme drowsiness or difficulty waking up. 5. Lips or skin turning pale, blue, or gray, more noticeable on palms for darker skin tones. Contact your doctor urgently if you 1. Experience worsening shortness of breath. 2. Have sharp pain when breathing or coughing. 3. Are vomiting excessively and unable to retain fluids. 4. Cough up blood. 5. Experience irregular heartbeats or palpitations. 6. Notice decreased urine output, a sign of dehydration. 7. Have an abnormally high or low body temperature, accompanied by shivering. If symptoms persist or worsen, call emergency services or seek urgent care. Diagnosing pneumonia. Since pneumonia shares symptoms with common colds, bronchitis, and asthma, diagnosis requires a thorough medical assessment. Doctors may 1. Ask about breathing difficulties and duration of symptoms. 2. Listen to the chest and back for abnormal lung sounds. 3. Take a temperature reading. 4. Order chest X-rays, blood tests, or mucus samples in severe cases. Advanced diagnostic techniques. Modern medicine has introduced several diagnostic tools to identify pneumonia more accurately. 1. Computed tomography, CORT, scans. These provide a detailed image of the lungs, allowing doctors to detect pneumonia more precisely than traditional X-rays. 2. Pulse oximetry. Measures oxygen levels in the blood to determine if pneumonia has led to low oxygen saturation. 3. Bronchoscopy. Used in severe or complicated cases, a bronchoscope is inserted into the airways to collect fluid samples directly from the lungs. Treatment options. Home treatment for mild pneumonia. Mild pneumonia is usually treatable at home with 1. Rest. Avoid strenuous activities to allow the lungs to heal. 2. Fluids. Stay hydrated to help loosen mucus and clear the infection. 3. Medication. Take antibiotics if prescribed, and always complete the full course. 4. Pain relief. Use over-the-counter pain relievers. 5. Cough management. Honey and lemon in warm water can soothe throat discomfort. Hospital treatment for severe pneumonia. Hospitalization may be necessary if symptoms are severe or if the patient belongs to a high-risk group. Treatments may include 1. Intravenous antibiotics and fluids. 2. Oxygen therapy for low blood oxygen levels. 3. Ventilator support in critical cases. Recovery and follow-up care. Recovery can take several weeks to months, and follow-up appointments may be needed for certain patients, especially smokers or individuals over 50. A post-recovery chest X-ray may be required to ensure complete lung clearance, particularly for older individuals or those with chronic illnesses. Causes of pneumonia. Pneumonia can be caused by various pathogens. 1. Bacterial pneumonia. Most commonly caused by Streptococcus pneumoniae, but also by Haemophilus influenzae and Staphylococcus aureus. 2. Viral pneumonia. Includes infections from RSV, influenza, and coronaviruses. 3. Aspiration pneumonia. Occurs when food, vomit, or harmful substances enter the lungs. 4. Fungal pneumonia. More common in immunocompromised individuals. 5. Hospital-acquired pneumonia. Develops in hospitalized patients, particularly those on ventilators. Emerging threats. Drug-resistant pneumonia. The overuse of antibiotics has led to antibiotic-resistant bacteria, making some cases of pneumonia harder to treat. Scientists are exploring new antibiotics and alternative therapies, such as bacteriophage therapy, to combat these resistant strains. Who is most at risk? Certain groups are more vulnerable to developing severe pneumonia. 1. Infants and young children. 2. Elderly individuals, especially over 65. 3. Smokers. 4. People with chronic illnesses, asthma, cystic fibrosis, heart, kidney, liver disease. 5. Individuals with weakened immune systems. Prevention of pneumonia. 1. Vaccination. The pneumococcal vaccine and annual flu shot can help prevent pneumonia. 2. Good hygiene. Regular hand washing reduces the risk of infections. 3. Healthy lifestyle. Avoid smoking, eat a balanced diet, and exercise regularly. 4. Prompt treatment of respiratory infections. Seek early medical attention for persistent coughs or colds. Pneumonia and global health. Pneumonia remains one of the leading causes of death in children under 5 worldwide, particularly in low-income countries. Conclusion. Pneumonia is a serious yet preventable and treatable condition. Early detection, proper treatment, and preventive measures can protect you and your loved ones. If you found this information helpful, don't forget to like, share, and subscribe for more health updates. Stay safe and take care.